Hello, I'm Mercedes Stevenson, and this is the West Block: Politics, Perspectives, and Players. Canadian health officials are keeping a close eye on the new strain of coronavirus that's prompted a state of emergency in China. Hundreds of cases have been reported in that country across Asia and North America. Infectious disease specialists believe the virus likely originated from an animal market in or near the Chinese city of Wuhan. But Canadian health officials say the risk here is considered low. Joining me now from Toronto is Dr. Peter Donnelly, President and CEO of Public Health Ontario. Thank you so much for joining us, Dr. Donnelly.
No problem.
Yep. A lot of people in Toronto remember the SARS outbreak. Toronto really was the epicenter of that. And you said in a press conference on Friday that you are expecting coronavirus to come to Toronto. What do you expect that virus coming to Canada to look like here? How significant do you think the threat is?
Well, I think it's likely that we will have a case. And I say that because we have lots of connections with China. We have a major international airport, so it's entirely possible that we will get an imported case of this new coronavirus.
When you look at how you expect the coronavirus arriving here in Canada to unfold and how the health center and health systems will respond, how do you think that that will differ from what we saw with SARS?
I think it will be very different indeed, Mercedes. The thing to remember is that we have much better preparedness this time around. So, for example, the organization that I lead, Public Health Ontario, wasn't in existence at the time of SARS. Public Health Ontario, and indeed the Public Health Agency of Canada, really came into being as a result of reflection on the SARS experience. And everybody felt that it made sense to increase the level and concentration of scientific experience and lab expertise. And so that's why my agency was brought into being. And working along with our ministry colleagues and with our public health unit colleagues, I think we are as well prepared as we can be for this and similar threats.
There is a test that can be administered for this particular virus early on. That's different than SARS. Can you tell us a little bit about when you're testing people? Is it after they're symptomatic? Is it people who have been in the cities that are affected? Who's a candidate for that test, and when is it being administered?
You're quite right. This is one of the very interesting bits of this story, which is that we already have an accurate, specific, rapid test for this disease. And that is so different from what happened last time around. You may remember that last time around we actually had cases of SARS in the hospital in Toronto before we even knew what was causing the problem. This time round it's completely different. We have the full genetic makeup of the virus that's causing the disease. Public Health Ontario have been able to develop a rapid, accurate diagnostic test, and what's more, we can turn that around within 24 hours. So we can tell frontline clinicians whether their patients have this disease or whether they don't within 24 hours. Furthermore, we're actually working with NML in Winnipeg to try and develop a test that's even more rapid. And that's a huge step forward, because in this sort of situation, what you want to do is to have rapid test results, and you want to have certainty so that the frontline clinicians, doctors and nurses know where they stand.
Now, obviously, you don't want to flood the healthcare system, especially during cold and flu season when people are having symptoms that could be just a regular cold or flu. So who are you giving this test to, and when should people consider seeing their doctor?
Okay, that's a very good point. Look, there is a very tight case definition for a good reason, which is that we only want to do these tests on people who are at significant risk of getting the disease. So at the minute, for example, someone would have to have a travel history to the particular area of China that is affected before one would do this test, along, of course, with the relevant clinical signs that would suggest that it might be an issue. Now, one of the things that we do at Public Health Ontario is that we have clinicians and scientists who are available to discuss in detail with clinicians concerns that they might have about an individual patient. So we talk to colleagues in hospital, we talk to colleagues in the public health system, so we make sure that we do the test on the right people and that we don't do the test unnecessarily.
Okay, Dr. Peter Donnelly, thank you so much for joining us. We know you're very busy and we appreciate your time.
No problem. Thank you.
That's all the time we have for today. Thanks for watching. For the West Block, I'm Mercedes Stevenson.